China doesn't have a COVID exit plan. 2 years in, people are fed up and angry. China battles the biggest surge in COVID cases since the original Wuhan outbreak. Hong Kong CNN. For 2 years, people in China have largely tolerated living under some of the world's most stringent COVID-19 controls. Restricted borders, constant digital tracking, and the potential for mass testing and snap lockdowns whenever a handful of cases appeared were all trade-off for the comparatively COVID-free life while the pandemic raged overseas. But China's inability to bring its latest outbreak under control so far has prompted online rumblings from frustrated citizens as questions about Beijing's zero-COVID strategy break into the mainstream for the first time. In the tech hub of Shenzhen on Sunday, videos shared online showed the residents protesting in the locked down district after restrictions lasted for several days longer than scheduled, according to social media posts. "We can't do this. We need to eat and pay the rent." A man among a crowd of protesters is heard yelling in anguish in healthcare workers who stood behind the high plastic barriers, according to a video shared online. "Unlock! We demand lifting the lockdown," others shouted in the second clip. In another instance, in the neighboring city of Guangzhou early this month, thousands of people were seen in the video footage trying to escape being caught up in a snap lockdown at the trade fair. Some hopped fences to avoid being locked inside the venue after a single positive case was found. Such scenes were largely unprecedented in China's more than 2-year fight against the virus. And while many remain supportive of keeping COVID-19 at bay, these instances are not the only signs of changing attitudes, as millions remain under lockdown and the cases continue to climb in China's worst outbreak since early 2020. The cases against living with the virus. The extreme measures were being rolled out even as the toll of COVID-19 within the highly vaccinated country has been limited so far. The caseload this month has now exceeded 56,000 cases across 28 provinces, though it is not clear how many of these cases were severe. Only 2 deaths have been reported since the beginning of the newest outbreak. Earlier this month, when the caseload stood at 29,000, officials reported some 95% were mild or asymptomatic. Some Chinese citizens now appear to think that health measures were more onerous than the illness. On China's popular and heavily censored social media platform Weibo, a question about why China can't relax its COVID-19 restrictions like other countries was the top trending hashtag on Wednesday, racking up over 500 million views. The top post linked to the interview given by the head of the National Health Commission's expert panel on COVID-19 that stressed that China must persist in its strategy to protect the vulnerable. The prominence of such a conversation is itself a radical departure from how questions have been dealt with in the past. Last summer, for example, ex-timid Shanghai infectious disease physician Zhang Wenhong came under a pictorial nationalist online attack by merely suggesting the country would need to eventually find a way to coexist with the virus. Now these conversations were playing out in the open as huge swaths of the country face significant restrictions to their daily lives in the latest outbreak. At least 25 million people across the four cities were under lockdown in the northern provinces of Jilin and Hebei, and untold number of others have been subject to district or neighborhood level lockdowns this month, including in the affluent first-tier cities of Shanghai and Shenzhen. Measures take their toll. A stark example of the human toll of China's stringent measures came on Wednesday, when an off-duty nurse died of the asthma attack in Shanghai after reportedly being turned away from several hospitals, including Shanghai East Hospital, where she worked. In a statement Friday, the hospital said that each emergency room was temporarily closed for COVID-19 disinfection when the nurse's family drove her there. Several outpatient and emergency departments across the Shanghai have been shut due to exposure to positive cases. Wu Jinlei, director of the Shanghai Health Commission, offers his condolences to the nurse's family and body to reduce the disruption to normal medical service, especially for emergency rooms, while hospitals are being disinfected. Reports of residents not being able to receive non-COVID medical treatment or having inadequate access to supplies in Shanghai circulated on social media earlier in the week. These were noted by Shanghai's prominent specialist Zhang, who called for such issues to be addressed in the future. People lined up for nucleic acid testing at the temporary COVID-19 testing on March 22, 2022 in Shenzhen. Otherwise, the significance of the success of the fight against COVID-19 will be largely compromised. Zhang, who is head of the Center of Infectious Diseases with the Shanghai-based Huashan Hospital of Fudan University, wrote on his verified Weibo account Thursday. Shanghai is facing its most serious outbreak yet, with 1,609 COVID-19 cases reported Thursday, and while authorities have denied they plan to lock down the city of 25 million people, numerous residents tell CNN that a growing number of neighborhoods are being temporarily shielded off to undergo mass testing as part of the rolling lockdown strategy, with local officials vowing Wednesday to further strengthen the prevention and control measures. And even in a city with some of the best infrastructure in the country, social media complaints suggest that systems to ensure residents have what they need are failing, as the lockdowns were extended without notice. How can I buy groceries? I can't get medicine for my kids. How can we order this online? When we can't even get a hospital appointment, wrote one social media user who said their Shanghai neighborhood had been closed for 15 days. Another complained that she was without staples after listening to the government assurances that supplies were sufficient and there was no need to hold. They said there was enough food, but they didn't mention that there wasn't enough people to deliver, she said. Wednesday, Shanghai's health authorities responded to the question about how citizens in the city's Jiading district could report problems buying groceries. Officials noted that they were making every effort to ensure supplies by supporting residents to use online platforms to get what they needed or arranging bulk purchasing and distribution. They also explained that some neighborhoods may see control period extended if positive cases were found, as screening will need to start again. And again. As for those wondering when the COVID-19 zero COVID strategy will end, China's health officials have been ambiguous. When asked at the news conference on Tuesday, government epidemiologist Li Wannian said China must not waver and stick to each plan while waiting for a range of things to happen. Outbreaks to ease overseas, the virus to mutate to become less dangerous, and better treatment and vaccines to become available. Under these circumstances, I believe we will thoroughly evaluate the situation of the epidemic in China and then take more adaptive measures to counter the disease, he said. But for those in China who are counting the days until they can be released from lockdown, such answers may not be reassuring. As one social media user who expressed this concern that the lockdown in his Shanghai complex could be continually extended, wrote on Weibo this week. Have the people in charge really not studies this issue carefully? The price paid by people inside is endless. CNN's Beijing bureau contributed to this report.